areas where symptoms of the similar symptoms are reported, you will see Kanana 47, Temba 32, Kekana Gardens 18, Sierman 14, Ramotse and Stinkwater 10. So this is the areas that is receiving priority in terms of health education and also water provisioning. So from our health, environmental health, you will see the different samples that they took. So samples taken from the 20th of May until the 29th of May, drinking water, that is then from the taps, rivers and streams, swabs taken, hand swabs, surface swabs, and food samples were also taken in the Hammanskraal area. A total of 157 samples were taken. To date, we've received 45 of those samples back. None of the 45 samples had any detection of vibrio cholera. So the environmental health specifically tested for vibrio cholera, and they did not get any detection on that. 32 of the samples is compliant, 12 samples are not compliant, and that is why, specifically if you look at the drinking water, the taps, we continue saying to the community, do not drink the water from the taps, drink the water that is then delivered by the water tankers. Those water has been tested, the tankers has been tested, and it is found to be clean for drinking purposes. Environmental health practitioners also go out to the community and do education and awareness to schools, funeral parlors, specifically on how to deal with the deceased, and then also early development centers. So we are doing education and training in that area. To date, a total of 21,000 pamphlets has been distributed to the community to make them aware of the specifically hygiene matters, because that is the biggest thing of cholera being spreading, and that's through hygiene. Housing and human settlements, this is the department that is then delivering water through the water tankers. They have 52 water tankers, of which 44 are in the region. What Housing and Human Settlement have done is they've allocated 30 EPWP workers to assist in the monitoring of the water tankers. A lot of allegations was made that the water tankers are not monitored. They collect water at various sources. The EPWPs assist. There's 4 hydrants in the Hammanskraal area that the water has been tested. Water is being provided from Magalies and Randwater. The EPWPs will be located at those fire hydrants to make sure that the trucks collect water only at those fire hydrants. There will also be an EPWP driving with the water tanker to ensure that deliveries are made and that the water is then again collected only at those four areas that has been identified. This thing is not going now. Okay, sorry. Water and sanitation. Water and sanitation also provides water tankers to the more formal areas in Hammanskraal. They are also responsible to do sample tests. So on the screen you will then see the water tankers that have been sampled, and other areas like the reservoir. None of the water samples that were taken were found to have any E. coli, F. coli and T. coli. So there is no any of those found in the water tankers. So in terms of the regional operations, in Region 2, the Executive Mayor received yesterday 5,005 litres bottled water from Old Mutual and Red Cross. He also received hand sanitizer and chlorine packs. 1,705 litres bottled water was then distributed to the community, and we also provided 505 litre bottles of water to the Temba clinic that will then also be distributed to the community. Other distributions that took place in the regions: Ward 49 received water, sanitizers 1 litres and sanitizers 2 litres. So we're focusing on providing sanitizers for people, for the community to have proper hygiene in terms of washing their hands. Ward 76, water was delivered, sanitizers 2 litres and sanitizers 1 litre, also 10. Tshwane Metro Police is actively involved in the deployment of its members. Tshwane Metro Police will do law enforcement in terms of illegal delivery of water. We've requested that water not be delivered that's not tested. It is essential that water that's delivered will only collect water from the 4 fire hydrants we've identified, because we have tested those water tankers and also the water source. Other water that's been delivered is not tested, and we're not aware of where the water comes from. And Metro Police will then have roadblocks to ensure that no other water sources enters the Hammanskraal area. Media announcements that we have also seen. One specific area that the Executive Mayor also referred to is a media statement that was done by Water and Sanitation from the department, where it says that the Rooiwal waste treatment plant could be the source. We have been conducted various sample tests at Rooiwal wastewater treatment plant, and there was no cholera found in any of the samples taken. Donations that we have received, and we would like to thank the donors as well. Old Mutual, who provided us with bottled water, purification tablets. Coca-Cola, that already just have 2 portable toilets at the Jubilee Hospital. They've also indicated that they will be providing us with a 34,000 litre water tanker that will make it easier and assist the community in the delivery of water. Red Cross, 10,000 5-litre bottles of water. Doctors Without Borders have delivered hygiene kits and water carrying buckets. The Lorium Disaster Management also committed that they will be giving us water and hand sanitizer. AMCA delivered 42,000 litres of hand sanitizers that we are distributing them throughout the community. Alimdad has made available 8,000 litre water tanker. So that water tanker has been tested. The water is being sourced from one of our 4 fire hydrants. So that water is safe, and it is then also distributed in the community of Hammanskraal. As the acting chief has identified, we've identified some risks, which is the availability of limited water, poor hygiene, and therefore we continue doing public education and awareness on hygiene. Contact tracing remains a challenge. The environmental health practitioners are currently struggling to do contact tracing. The community protests, we are aware that there were some allegations or suspected of community protests, so our Metro Police officials are on board and they are monitoring the situation. And then one of the concerns is the illegal delivery and selling of water. As we've already indicated, we do not know where that water comes from, and it's essential that the water be tested prior to delivery. And then volunteers, we are receiving various volunteers. Our request is that the volunteers coordinate with the city and not to go into the community, because we have a distribution plan, and we would like to implement the distribution plan, obviously with the assistance of various volunteers and donation. Then in conclusion, the Disaster Operating Centre has been activated, and the coordination of the distribution plan. Okay, the doc number, please do not take the number.
Please want to be careful. This is not a public number. This presentation was done to Hammanskraal ward councillors, and we're giving ward councillors a dedicated line. So if we share this with the public and it gets flooded, that line is just going to shut down. So
I'm trying to move on, but it doesn't.
I think that's the conclusion. Is it?
Yeah, thank you. It is. Thank you. I tried to go faster.
Yeah, that number.
Okay, just in addition, acting COO, I wonder, he was whispering in my ear, but I would like him to say it himself.
Okay.
Just in addition to this presentation.
Okay, thanks, Executive Mayor. As indicated, the Acting Chief Operations Officer. And just to add to the presentation, we're collaborating with a number of stakeholders, which include, amongst others, CSIR. We have done joint testing with them, together with the National Department of Water and Sanitation. so that we make sure that all the results that we receive are credible and we have those independent partners on board. Just to indicate as well that further stakeholders involved in the process, we have just given a green light to WISA, that is the institute, to help us with the assessment and give us some recommendations, so they are on board. We've got, yes, in the meeting last night with National Department of Water and Sanitation and Health, it was mentioned that as well, I think Water Research Commission would be synthesizing all the results or test results that have been gathered by all entities that are involved in the testing of water, food, and everything else. That's important to note. Thanks, EM.
Thanks very much. And that was Mr. Kwena Mkoko, the acting COO, as well as the head of the health department. And so he knows what he's talking about. In addition, I can just say that this morning I met with all of the ward councillors from Hammanskraal to share this information with them, to give them dedicated resource to communicate with the city, to make sure that we're not working at cross purposes, but also to get their input. And they've raised a number of additional issues that they want us to focus on, including open sewers in many places, sewer leaks. They've raised the issue of Kekana and the tribal land that is under the control of the chief, and where we need better collaboration with traditional leaders, because in many of those places there are still pit latrines. So that's an area outside of the jurisdiction of the municipality. There are pit latrines. We must monitor that situation. It's been a long-standing issue where the city has pushed for township establishment and title deeds to individual owners. But until that is resolved, we also need to work closely with traditional leaders in the area. They've raised issues around waste collection, as well as informal settlements, land grabs, and so forth, which we're taking very seriously and trying to cooperate with those councillors. Folks, that is that for the presentations. I will now happily facilitate questions that you might have, also to those who have spoken here from the officials, to the extent that we can answer them. I'd ask that we just, if you're asking a question, just identify yourself. I know many of you, but just for the record, this is who I am, and this is my question. If we can have questions.
Michael, thank you, Mayor.
Will you handle this, Sipho? Yeah. Right.
Cool. All right. Okay, we'll start over there. Kaya FM. Cool. Yeah.
Mayor Tatel Supporter from Kaya FM. Just my first question, Mayor, could you please just, I know you touched on it briefly, but just expand on the allegations of the unauthorized water sources or water providers, just your message to community members as to how they can identify if someone is registered and so on. And then there also are allegations that there are water tanker syndicates, or there's some sort of criminal element in the people who provide water through the tankers. And just a last one, Mayor, your message to, I understand that 2 children, aged 7 and 9, were part of the 23 who died. Just your message particularly to these families who have lost loved ones.
All right, thank you. Let's just keep my questions to 2 colleagues, because there's many to go around. We'll have the second one. Anton?
Good morning, Anton Meyer from Pretoria FM. I would just like to find out, are we seeing a decline in the number of cases or people admitted at in Hammanskraal at the hospitals? If we look at it in a, let's say, an overall from the past 2 weeks. And then the donations, are you still asking for donations? Do you have enough water? Is there something that the city desperately needs in Hammanskraal, where people can actually lend a helping hand? Thanks.
Can you go ahead?
Zola Shalana from Museum Africa. So, Mayor, when we spoke to the residents, they indicated that the issue of water has did not start now in the area of Hammanskraal for the past 2 years. Because we spoke to one of the guys that sells water there, saying that this has been going on for some time. If you could just provide clarity for us there, how long has that issue been going on?
You mean the quality of the water?
The quality of the water is.
Okay.
All right, Aaron, and we'll stop with you, and then we'll have a second round. Yeah.
I'm Aaron from the Daily Sun newspaper. I just want to ask Mayor about the deceased victims of cholera. Are there any conversation from the city, or are there any help of burial of families who can't bury their loved ones?
We'll keep it the first round, and then we'll have another second round. And if I may ask the city officials, when you respond, please introduce yourselves again and your titles, just so that the media colleagues can capture your name and titles correctly. Thank you very much.
Thanks very much. I'm going to ask the acting COO to answer the question as to the trends in the cases. I want that to come from official. And then after I have spoken, of course, if I've missed anything, it's an open. Please don't let my word be the final word. And if I say things that are wrong, please correct me. I'm just a politician. Okay. KFM, the concern that of water operating water. Now, the first message that Tshwane wants to deliver is that the water we provide through the 44 acres is free of charge. The city of Tshwane and the licensed water contractors are not allowed to charge for water. We as the city are paying for that. And the additional point I want to make is that unless somebody has a permit, they're not allowed to sell water, especially in these circumstances, because we don't know where that water comes from. The risk is that some operator might be supplying water to a building site, so pulling water from a river for cement to be mixed at a building site, and then they moonlight in selling water to communities. We don't have any control over those private contractors, and that's why we're saying be extremely cautious of anybody selling water via a water tanker. Please contact the Tshwane Metro Police, take a photo of the number plate, because that will allow us to correlate from the e-nature system who that person is, and also to check whether it is our service providers. As to the management of these water tankers, it is a difficult process because now, because of the problems with Hammanskraal water, they become a semi-permanent part of our water value chain. And as a city, we're not in the business of water tankers. We're in the business of basic services. And it becomes very difficult to manage the quality, but we've put in place measures. We've dedicated additional personnel, including EPWP workers, to assist at abstraction points, to assist to see where the water tankers are going. And we've also now opened the line of communication with the ward councillors to manage that situation. I take very seriously the reports in the Sunday Times, in particular, where certain folks spoke off the record and said that there is possible criminal involvement with water tankers. We don't have any evidence of that thus far, but what I can tell you is that if we fix Rooiwal and if we make sure that water is supplied through our infrastructure, the water tanker business is going to lose a lot of money. In fact, large parts of that business is going to go out of business. And so you can imagine there is a vested interest, but what we would want to do is share as much information with the media and the public, including investigative journalists. And if you pick something up, please don't even come to us, blow it up, publish it, and action will follow from that. That's the best possible guarantee in these instances. And I want to, acting COO, again extend the offer to the media. We'll publish, Patricia, as we did the previous time an issue arose, and Anton as well. We'll publish the list of service providers and see if you can find any connections that might be improper. There are contracts in place holding them to certain standards, and if they do misbehave, we can cancel those contracts. I hope that has answered the question as to the water tankers. It is horrific every life that is lost due to the cholera outbreak, and the children in particular. I have written to the Premier of Gauteng, Panyaza Lesufi, to indicate what the city can contribute in terms of assisting the families. And I've asked the Premier if he can match that allocation, because that will assist us in just, giving a meaningful. I have not received a response from him. I'll follow up, but that hasn't stopped the city from taking the necessary steps on our side. Unfortunately, it's not as easy as just paying out the money or paying out invoices, because that can land me with certain findings of irregularity. That money will come from the mayoral discretionary fund. That is where we've got allocations. It's not usually used for this purpose, but given the tragedy, given the circumstances that we have, the only problem is we've got to go through certain processes, and so there will necessarily be a delay in getting the financial assistance to the families. Remember, there's also a process of talking to the families, identifying who to give the support to, establishing the next of kin, and we've got social workers who are dealing with that. There are, I think, one or two instances of undocumented foreign nationals who've also succumbed, and we must see how do we deal with those circumstances where we cannot find a next of kin. That would also be a difficult circumstance to deal with, but we're fully committed to dealing with it, and I am following up with other spheres of government to see if they can possibly top up, I would say, the contribution that the city can make in terms of support to families. Sure, FM, I'm going to let the health practitioners answer the question as to the trends, whether they're declining and so forth, and perhaps you should do that, and then I will also just have a word about donations and what would be required. Okay, thanks very much, Executive Mayor. In terms of it's still too early to tell whether the numbers are going down. We currently are experiencing spikes on some days, some low numbers on some days. But what is giving us a promise is the fact that in the last 24 hours at least we did not record any further deaths. Critical to this is for us to reduce morbidity and mortality, but even more better, the mortality itself, meaning the actual people dying from the disease, which would then talk to the issue of effectiveness of our clinical protocols. I just need to indicate that as well, we have been in this space for about 2 weeks now. Level of alertness and awareness in the clinical setting as well as in the community, and the interventions that we have put on the ground in the form of education and awareness and everything else that we are doing on the ground should help us start seeing a different picture in the weeks to come. So that's our hope, and we feeling that would happen. As we can see now, at least for the last 24 hours, we have not recorded any person dying from this. Thanks very much.
So I have already introduced Mr. Kwena Nkoko, who's the acting OO, and the Chief Musia, so acting Chief of Emergency Services. If there's any other questions as to the identity of the officials, please let me know. Tanya, sorry, what is your surname? Terblanche. Dr. Tanya Terblanche from Emergency Services, who did the presentation. As for donations, in these circumstances, and given the level of distrust of any water sources, including water tankers, there is a need for water. There is a great need for bottled water or for water tankers. And so we welcome the support by Old Mutual, by SPAR, by Gift of the Givers, by Doctors Without Borders, and all of these entities who they don't stand outside of Hammanskraal. They tell us we're part of this community. This is our clientele. This is our customers. We do business in these communities. We care about them. So Anton Water, any assistance with sanitary kits, hand sanitary kits, are welcome. As indicated in the presentation by Dr. Terblanche, it's not that we want to hog these resources. We just want to make sure, we want to give corporate entities a place to say,
if you take things for donation, we can secure, we can secure that, and we can make sure that it is distributed in an equitable way. Also, it gives us the opportunity to check whether, in fact, clean goods and goods that haven't expired and so forth can be distributed. I just want to allow my colleague Ofense Madzebetela to make a point very quickly. He is the MMC for housing, and I invite the other MMCs also to correct me where I've made any mistakes or to add to anything I've said. He just wanted to answer to Kaya FM's issue on the water tankers.
Thank you very much, EM, and good morning, colleagues. Right, the issue of water tankers, we have 88 EM that is operating. We have 44 from formal sector, and as well as 44 from the informal sector that we are giving
in the affected area.
Yeah, in the affected area. And then we are also having, each and every water tanker has a certificate that indicates that they are allowed to operate in that area. So any other water tanker that does not have that, hence the roadblocks from the TMPD that will deal with those water tankers in order to manage that situation. And maybe Dr. Telbranch also on what the EM is saying around the issues of donations. The reasons why we want to also coordinate the donations is because of the chlorine tablets that you spoke about, the dangers of that. Maybe Dr. Telbranch can elaborate around that issue as well. Yeah.
Yes, sorry, Dr. Tsibwe, we're playing musical chairs, but I think maybe it's important.
Thank you, MMC. So what we ask is in the hygiene, the chlorine tablets not be provided. The water that the city is provided in the of chlorine. So there's additional chlorine added to the water. There will be an overdose, which is also not good for the health. So we ask that chlorine packs do not be provided and donated, and that the community that's receiving water from the water tankers, it's no need to add chlorine or any chlorine water purification tablets. The water is clean. There is sufficient chlorine in the water. Thank you.
Going on with the that were raised, new broader water, and I hope this is the answer to the question that you actually have, or this is the right answering. As far back as 2004, there was indication that the wastewater treatment plant that treats water that then gets released into natural water resources and purified at Temba, which is a separate purification plant. As far back as 2004, the city had an indication that plant was reaching the end of its capacity. That warning was issued again in 2008. By 2001, the first contravention notices were issued by the Department of Water Affairs against the city to say that you were polluting natural water resources. In 2016, there were initiatives to try and upgrade the plant, because that's the essential issue. You have to upgrade Rooiwal wastewater treatment plant. It's out of capacity. It doesn't have what is needed in terms of infrastructure to treat the demand, or the inflow of wastewater effectively. And to the extent that it can't, that's where we've got problems at Temba with the quality of the water. And that's why we have to over-chlorinate. Well, not over-chlorinate. We've got to heavily chlorinate the water at Temba purification plant. So there has been this issue of the irregular tender that was awarded in, I think, 2019, which has been the subject of a forensic investigation. I think Edwin Sodi, the person who is implicated at state capture, has an association with a consortium that won that tender. That tender was also cancelled due to the contractor not performing. Forensic investigation followed, and it was found that the tender was awarded irregularly. Several officials of the city have been implicated in this, and the disciplinary processes, as well as an investigation by law enforcement, is ongoing in this matter. It didn't just go away, but disciplinary procedures have to be finalized. I've also said to the Minister of Water, if he can assist us with an SIU investigation. The SIU did a preliminary investigation, but the President has to make a certain declaration for an SIU investigation to go forward. And I'm meeting with the Minister. The City of Tshwane fully supports an SIU investigation into the matter. Where we are now is to deal with the problems of the past, the mistakes, the forensic findings, but also to take responsibility for the actual upgrade of the plant. We've budgeted, although that budget will only serve in tomorrow's Municipal Council meeting. Councillors are voting on that budget. It's a draft. But we've proposed 450 million rand in the next 3 years to upgrade Rooiwal. And we've said that's not enough. Stage 2, phase 2 of that upgrade is going to cost 2.5 billion rand, which is the entirety of the capital budget of the city in any one financial year. So we've significantly increased the allocation, but we've also said to Department of Water Affairs, to Treasury, to other organs of state, please assist us, help us with a funding model, and help us with an implementation model, because we don't want to have Edwin Sodi win the 450 million rand tender again. We want the implementation of that project we want the integrity of that to be assured, and we're alive to the risks that continue to exist in the city's own supply chain management system. I've been fairly vague about the discussions between me and the Minister of Water that took place on Friday, and the reason for that is a particular solution was discussed, but for that solution to be implemented, we need the buy-in from National Treasury and other spheres of government. And this morning, the city manager had a meeting with the technical team, the Director General of Water Affairs. That was discussed. Because I've been in meetings with ward councillors the whole day, I haven't been able to get it. But I think we will meet later again this week and hopefully we will have announcements of how Rooiwal will be upgraded in a far shorter period of time than just waiting for the city to do it in a piecemeal, limited resources we have. The question by the Daily Sun, I think I've indicated from the city side how we propose to assist the families of the deceased. The problem is to take long. It's going to take longer than we would want it to take. I mean, if I could just despair to assist those families, I would, but we also have to follow our own procedures, and also we would like to work with other spheres of government to see if we can give a significant contribution beyond just what resources will allow.
Thank you, Mayor. Second round of questions.
Mariska from the Citizen. Environmental angle. Hammanskraal water everywhere on the ground, and I spoke to the residents, and they, for instance, claimed that it was rainwater, which to me didn't sound possible because it didn't rain in that time, and I especially saw it around the hospital area. So I want to know, is there maybe something going on like underground water pushing up, and has that been tested?
All right, great.
Tshwane from Eyewitness News. I have a couple of questions, but two of them are like very close-ended. So obviously, there's a lot of talk about this water mafia, water tanker mafia, if there is one. So I just want to know, on average, maybe how much is the city spending on an average tanker or in total, whichever figure you can give me.
I anticipated that question.
And I think maybe the doctor can take this question. I know obviously when we started reporting on this, the number of people we spoke to, they did anticipate. I think when we started reporting the cases, the deaths were at 6. So there was an anticipation that the number will grow, because obviously a lot of people have not been sort of registered or sort of confirmed to have died of cholera. So I just want to know, how long does it take to sort of confirm that someone does have cholera, and how long does it take to confirm that they died by cholera? So I think that just gives us an idea if more cases are going to be added to the death toll. And just my last question, And the doctor said there are issues with contact tracing. I don't know if you can elaborate on that. What are those issues and what are the potential pitfalls of that? Thank you.
Can I ask Milani just to come a little bit closer? Dr. Tanya, I don't want to take away your brief, but we also have environmental healthcare practitioner. If you can just be on standby, we just want to finish the round of questions. Sipho?
All right, thanks, Saluso. Do we have another question, colleagues? Okay, Punzile.
Punzile from the SABC. Just on the issues that are tested, we continue the tracing. I just want to understand where to from now. If you cannot find source, what is the next step? Could it be possible that perhaps there was a tanker that was contaminated and it wasn't tested? Because we've had residents saying that prior to the CT standing up and saying they must go get water from the hydrants, other tankers were taking shortcuts. Is there a possibility that perhaps that could have been the case? And also, can you confirm whether it's true or not that contractors were not paid for about 4 months? We had some allegations that contractors were not paid for 4 months. And the last one, there have been calls from some community members to be exempted from load shedding while there is this issue going on. Have you received such a request? And if so, what can you do?
Thank you.
Right.
Thank you. All right. Is there a mayor?
Mariska? She's gone, but I think I would want Lani, whose full name escapes me for the moment, but she also introduce the possible. I know it's a bit speculative, but we can maybe just give a comprehensive answer. Tabiso, I just want to finish the questions and then give over to the experts. The cost of the water tankers. So in any 1 year, the city spends between 350 million and 400 water tankers. This is divided into 2 parts. The one is rudimentary services to settlements, which we know grows as people urbanize and as there is pressure on the city to provide rudimentary services. That is provided by the Human Settlements Department. The other area of water provision is through the Utilities Department, and that is typically such as a like Temba, where that the water is not of potable standard, and so we've got to take additional measures. If there's a Rand water outage or a Magalies water outage, we send in the water tankers as a stopgap measure or to provide water in the meantime. So those are the global figures. It is a lot of money. I mean, it's close to the figure that the city spends on repairs and maintenance. And it's simply too much. We have to reduce this cost, and we'll also have to examine the cost per water tanker. The information provided to me is that a water tanker costs between 1,000 and 1,500 per day, depending on the size of the community and so that's an indication. Also, the input running a tank is comparative. This is business, and we need to see how do we reduce dependence on water tankers over time. I hope that answers the question in terms of the. I just want to see if there was any where I can. Pumzile. Where to now? We've called in the assistance of the CSIR, the acting COO, other institutions, including the Water Institute of South Africa, and there was the medical
MRC is on board.
MRC, the Medical Research Institute, Medical Research Council. The important point is to give up, because if rising, then we haven't determined the source, and we must check the whatever expertise. Somebody said to me, well, you live in the city with the most research institutes in the country, and we are determined to tap into that resource and have them assist us to say, this is what you're doing right, this is what you're doing wrong, this is where we can help correlate results. We're certainly not giving up. Let me just also say, water is one possible source. So drinking water from streams, baptizing or swimming in natural water sources, which is very common in our communities. It's not a way out thing, it's every day. Handling of, and this was raised by the Hammanskraal ward councillors to say, you've got so many informal rules around and parts of Hammanskraal, and typically your environmental practitioners would go to the formal businesses to check your health certificate. But I mean, somebody on a corner can simply go to the corner if they see environmental health practitioners. It's important for us to send those health in there and to do sort of an intense blitz of informal food stalls. That is another possibility that we cannot exclude. It's so important to detect the source before you just assume that it's rooiwal. As for the that don't get paid, we got the allegations in our meetings with the it's certainly something we'll check up on. But what I do know is that in the past months we've been far more stringent before paying these invoices. Into the contracts have been built-in mechanisms that the water tankers must give evidence of where they abstracted water, where they delivered water. There's a whole log that they have to give as part of the controls process, because it was instituted, it was simply, we pay your invoice and that's it. But now there's all sorts of controls, and the interesting thing, some water contractors complain that they don't get paid, while others we're fine. In the part of the reason is we are instituting stricter controls, but I'll certainly double down and see if there's really an issue of non-payment. I would then just taking note of the technical questions. If you can just come and take my seat, as well as introduce yourself and answer those last questions.
Thank you, Executive Mayor. Good afternoon. Tshwane Department of Health. I think I just want to start by indicating that the City of Tshwane health officials are supporting the overall outbreak response that is led by the Gauteng Department of Health. Our environmental health and outbreak response team members are situated at the Jubilee District Hospital. This is where the combined outbreak response team is situated and from where all activities are coordinated. They have a briefing session very briefly every morning. There, the updated line listing is discussed, and the activities in terms of household visits, contact tracing, and where the necessary sampling has to be done is activated from that one specific coordinated outbreak response team. In terms of sampling from the environmental health side, from the city officials, they have cast a very wide net in terms of samples. Dr. De Blanche has indicated the list of the samples that were conducted, inclusive of streams and other water sources. We have not, to my knowledge, conducted samples of the water as was indicated by one of the press members that is standing around the hospital. I can, however, say that all identified risks, we request the community, if there are any sources that they feel at risk and that we should investigate, to contact our environmental health practitioners. We have recently opened a new satellite environmental health office at Lovers Lane, TMPD office in Mandela Village. I think in terms of the question relating to the time it takes for sampling and results, the culturing of stool and rectal samples to confirm if a patient has cholera takes approximately 2 to 3 days. If we talk about tests required to confirm if there is Vibrio cholera in water samples, this can take between 7 to 10 days. In terms of the confirmation of the number of deaths that has been confirmed to be cholera, in the ministerial briefing last night, we were informed that it is 9 out of the 23 cases that have unfortunately died. And I think we have been asked to be cautious, not to give further indication on how long this process will take, especially since the city is not managing that process and it is being managed at a Gauteng and National Department of Health level. I hope that covers the questions that were posed. Thank you.
Yeah, so I mean, obviously, I don't want to step into the health doctor space, but deaths, symptoms, probably the deaths. You may sort of assume that that could be cholera as well. It hasn't everyone been. If you see a total number of deaths, but only so many confirmed cases, technical answer, but assume diarrhea and all of the other symptoms associated with cholera, subject to cholera.
Any gastrointestinal symptoms, any health facility, medical staff have been allowed to treat infected cholera.
Yes. So, folks, Sipho, that concludes the briefing. The city is continuing to work with other spheres of government, with private research institutions. Thank the media for communicating as scrupulous to peddlers, as well as that are contracted. We also the that we've received to manage this. We will try our best. As Milan stated, we've got a national and provincial just give information because they are in charge. But as we can, we will share with the media. For your help. Thank you.